We're going to do 3 views of a hand, so a PA, oblique, and a lateral. So again, we want the patient sitting at a right angle to the table, their elbow bent at 90 degrees, all fingers parallel to the IR. First thing we're going to do is put a shield on the patient.
I'm just going to put this on your lap.
We want to do that first so we don't forget. So we want to make sure all the fingers are parallel with the IR. We're going to open that up, make sure you have light all the way around so we don't cut off any soft tissue or any phalanges. I'm going to put a left marker on the film. So we're sitting right at the base of the 3rd metacarpal. So this would be a PA projection of the hand. Now there's one thing I don't want people to do, or don't want, is put it straight out. If you put it straight out like this, the hand automatically has a tendency to roll laterally, so that would be incorrect. It would be partially obliqued. So always at a right angle whenever possible, and this would be a right angle to the table. So try to do that. The other way is really, the hand is always oblique if you put it straight out. So try not to do that. Our next projection is going to be an oblique of the hand. It's a 45-degree oblique. We're still centering at the base of the 3rd metacarpal. We're going to try to separate our fingers. Again, you're touching somebody that has an injured body part. Make sure that all fingers are parallel, but try not to hurt the patient. If you have to, we can just go up here and we can move the patient like that so we're not actually touching the hand that's injured. So if you notice, there's no superimposition of the phalanges, and the fingers are nice and parallel. Now if I put the hand down, I'll put it back onto an oblique, we'll put the fingers down. That is not good because all these joints, DIP, PIP joints, are all going to be closed. The only reason that would be good for if we have a known metacarpal fracture. If it's not, if you do a regular oblique, you can't go wrong. So just do that one all the time and just bring the thumb up. So all fingers are at a 45-degree angle and they're all parallel with the IR. So this keeps our joint spaces open in DIP, PIP, and MCP joints open. Then we're going to do a fan lateral. It's a little tricky. You could actually do this one straight out if you have to. This patient doesn't seem like they have to do it that way. So we want all fingers to be parallel with the IR. We want the metacarpals to be perpendicular to the IR. Make sure you have light all the way around. Centering is a little bit different. We're centering at the 2nd MCP joint. But this is a fan lateral, so all fingers are in a true lateral position. What I don't want to see is these fingers touching. If the fingers are touching like that, we're actually superimposing soft tissue. So some people might say to make the OK sign, but it really shouldn't be. It should be an OK like that, not actually touching. So that's views of the hand.